So let's define placenta accreta. Placenta accreta is the abnormal implantation of the placenta. Normally, first, the placenta has to implant up to the endometrium. Which part of the endometrium is supposed to implant up to the endometrium functionalis? Is it clear? You need to know that we have the uterus. So let's say that this is the uterus. The uterus is made up of layers. The first layer inside is the endometrium. Is it clear? Then the next layer is the myometrium, and then the last layer is the serosa. Is it clear? So those are the different layers of the or the epimetrium. So those are the different layers of the uterus. So the first layer, which is the endometrium, let's say that the endometrium is here. The endometrium is divided into two parts. We have the endometrium functionalis, the stratum functionalis, which is just overlying the other part of the endometrium called the stratum basalis. So we have two main parts of the endometrium: the stratum functionalis, which is superficial, and we have the stratum basalis, which is down. Now the stratum basalis is the one that is not shed up when you have menstruation. The one which is being shed up is the stratus functionalis, and the stratum functionalis is what is important in case of pregnancy, to maintain pregnancy. Are you understanding? So now the placenta, normally placenta has to implant at the level of the stratum functionalis only. Is it clear? When the placenta implant up to the stratum basalis, it is called the placenta accreta. When it implants up to the myometrium, it is called the placenta increta. And when it implants up to the serosa and even the overlying structures of the peritoneum, is called placenta percreta. So those are the different layers. So this is the stratum. The first one is stratum functionalis. The next is basalis. All this is making part of the endometrium, and then this is the myometrium, and lastly this is the serosa. So those are the different elements that you have to note and the definitions. So now you can have all these abnormal as risk factors. Is it clear? Now so you can have other risk factors like gestational diabetes. Is it clear? Gestational diabetes is also another risk factor for preeclampsia. Is it clear? Another obstetric related case of preeclampsia, you have nulliparity. Is it clear? So a woman that was nulliparous for the first 30 years, nulliparity for the first 30 years is going to also be an obstetric risk factors for preeclampsia. Now the next is a neopaternity. That's another risk factor, neopaternity. So let's say that a woman had a child with the first father, and then there's a new father for the next child. It's also another risk factor for preeclampsia. The next one you can have also so those are the different risk factors that you can have in the case of preeclampsia. Another one can be grand multiparity. Is it clear? Which usually associated also with the age of the patient. So those are the different things that you can have which are risk factors of preeclampsia. So from this we now continue with the next, and you need to know that what these risk factors of preeclampsia, you can bring it out from your identification, and you bring it out also from your past history. Is it clear? You need to know that what in obstetrics and gynecology, the identifications of obstetrics and gynecology, we have it's made up of different parts. The first part of the identification of obstetrics and gynecology is made up of the nasomat. Is it clear? You have the nasomat. Is it clear? And then the next part of the identification of the obstetrics and gynecology, you have to always put the first element is the last menstrual period. Every time you are taking a history of a patient which is gynecological or obstetric related, you have to take the last menstrual period, and next you have to measure the gestational age. To know how to measure the gestational age, you use the Nagel's rule, and I've explained the Nagel's rule on the SCH account on TikTok. Is it clear? So you go there and visualize it. So now, after using the negation, after measuring the gestational age, you now have the expected date of delivery that you have to speak about, and you have to speak about the blood group. Is it clear? And now you need to know that what on the age you can also have, you already have a risk factor for preeclampsia. So the next one, the other elements we have, so there are different elements which can tell you. The next one is the gestational age. Gestational age is very important in these cases because if you are less than 20 weeks of gestation and you have a patient that is having a high blood pressure, you're not going to speak about pre-eclampsia, basically. So that's why you need to know that there are different other hypertensive disease in pregnancy, basically. And I'm going to tell you now they are different. They do those different hypertensive disease in pregnancy for you to visualize the different introduction to that, basically. Now, after seeing those on the identification,